Joint pain is a common problem affecting millions of people worldwide. It can range from mild discomfort to severe, debilitating pain, interfering with daily activities and reducing the quality of life. As we age, our joints naturally experience wear and tear, making them more susceptible to pain and injury. However, joint pain can affect people of all ages, and understanding its causes and available treatments is crucial for maintaining optimal joint health. Joint pain can stem from various factors, including injury, overuse, and underlying medical conditions. It's essential to identify the root cause of the pain to receive appropriate treatment and prevent further damage. While joint pain can be frustrating, there are numerous ways to manage and alleviate it, allowing you to live a full and active life. One of the most prevalent causes of joint pain is arthritis, a general term encompassing over 100 conditions that affect the joints. Osteoarthritis, the most common type, develops when the protective cartilage cushioning the bones within a joint wears down over time, leading to pain, stiffness, and reduced range of motion. Another common type is rheumatoid arthritis, an autoimmune disorder where the body's immune system mistakenly attacks the lining of the joints, causing inflammation, pain, and swelling. Gout, another form of arthritis, occurs due to the buildup of uric acid crystals in the joints, typically affecting the big toe. Apart from arthritis, joint pain can also result from injuries such as sprains, strains, and fractures. Overuse or repetitive motions can also irritate the joints, leading to pain and inflammation, often seen in athletes and individuals engaged in physically demanding jobs. Fortunately, there are numerous lifestyle modifications you can adopt to manage and prevent joint pain. Maintaining a healthy weight is crucial, as excess weight puts added stress on your joints, particularly the knees, hips, and back. Losing even a small amount of weight can significantly reduce joint pain and improve mobility. Regular exercise is also essential for maintaining healthy joints. Low-impact exercises like swimming, cycling, and walking are gentle on the joints, while strengthening the muscles that support them. Adequate hydration is also vital for joint health, as it helps lubricate the joints and prevent stiffness. Consuming a balanced diet, rich in fruits, vegetables, and omega-3 fatty acids can also help reduce inflammation and support joint health. Incorporating foods high in antioxidants, such as berries and leafy greens, can help protect your joints from damage caused by free radicals. While lifestyle changes can significantly improve joint health, seeking professional medical advice is crucial for diagnosing the underlying cause of your pain and receiving appropriate treatment. Your doctor can recommend various treatment options depending on the type and severity of your joint pain, ranging from medications to physical therapy. Medications like pain relievers and anti-inflammatories can help manage pain and reduce inflammation. In some cases, your doctor may recommend corticosteroid injections directly into the affected joint to provide targeted pain relief. For severe cases, surgery may be an option to repair or replace damaged joints. Remember, taking proactive steps to manage your joint health can significantly improve your quality of life. By adopting healthy habits, seeking professional guidance, and staying informed about your condition, you can effectively manage joint pain and enjoy a more active and fulfilling life.